Over the past few years, something has changed in the operating room. I've begun to see patients I was not trained to expect. Individuals in their 20s and 30s arriving with severe coronary disease. Not mild changes, not early warning signs, but advanced, life-threatening blockages. These are not isolated cases. This is a pattern. And when patterns appear in medicine, they demand an explanation. As a cardiac surgeon, I do not see lifestyle on the surface. I see its final result, inside the arteries, inside the heart, where damage can no longer hide. And what I'm seeing in younger patients is both aggressive and preventable. What is actually happening inside the heart? A heart attack is often described simply as a blockage, but in reality, it is the final moment of a much longer process. Inside the coronary arteries, the inner lining begins to lose its normal function. It becomes more vulnerable, more reactive. Over time, particles of cholesterol enter the vessel wall and begin to accumulate. This is not just fat. It is an active, inflammatory process. The body treats it like an injury. Cells gather, the area thickens, and a structure we call a plaque begins to form. For years, this plaque may remain silent, but at a critical point, it becomes unstable. It ruptures. The body responds immediately by forming a clot. And within minutes, blood flow is cut off. That is the moment a young, otherwise healthy individual collapses. Why this process is accelerating in the younger people? The key question is not what happens. We understand that well. The real question is, why is this entire process starting earlier, progressing faster, and presenting more aggressively in young individuals today? The deeper cause is one: early damage to blood vessels. In many young patients, the blood vessels are exposed early to harmful conditions: poor diet, abnormal cholesterol, elevated blood sugar. Even before symptoms, the vessel lining is already under stress. Once this protective layer is damaged, the disease process begins quietly, but continuously. 2. Persistent internal stress. Modern stress is not short-term. It is constant. The body remains in a prolonged state of alert. This leads to sustained increases in blood pressure and inflammatory activity within the vessels. Over time, this environment accelerates plaque formation and instability. 3. Reduced physical demand on the heart. The heart adapts to the demands placed on it. When physical activity is low, the cardiovascular system becomes less efficient. Circulation slows, metabolic health declines, and the body becomes more prone to storing excess energy as fat within tissues and vessels. 4. Direct vascular injury from toxins. In patients who smoke or vape, the progression is often more rapid. The chemicals directly injure the vessel walls, making them more fragile and more likely to develop unstable plaques. This is one of the clearest patterns we observe. 5. Loss of physiological recovery. Sleep is when the body restores balance. When this recovery is consistently disrupted, the effects are subtle at first, but cumulative. Hormonal imbalance, elevated pressure, and vascular stress gradually become permanent features. The critical mistake young patients make. The most concerning factor is not just the disease, it is the delay in recognizing it. Young individuals often dismiss early symptoms: mild chest discomfort, breathlessness, unusual fatigue. These are often ignored because they do not fit the expectation of heart disease. By the time intervention is required, the condition has already progressed significantly. The reality of treatment versus prevention. In surgery, we can restore blood flow, we can bypass blocked arteries, but what we cannot do is erase the underlying process that created the disease. That process continues unless the cause is addressed. This is why prevention is not optional, it is essential. Sharp, memorable, impactful. What concerns me most is not that young people are developing heart disease. It is that many of these cases follow a predictable path, a path shaped by daily habits, repeated over time. The heart does not suddenly fail without warning. It reflects years of silent adaptation to the life it has been given, and by the time it demands attention, the damage is often already advanced. The difference between prevention and intervention is time. And in cardiovascular disease, time is everything.